Blog Talk Radio. Welcome to Medicaid Matters, the only live talk show about the business of Medicaid health care. And now, here's the host of Medicaid Matters, Richard Yadon.
And thank you, Braley. Good afternoon, everyone. It is a gorgeous day here in Nashville, Tennessee. We're broadcasting live from the offices of Managed Medicaid Services. And we are glad you are joining us here for the next hour to learn more about some of the innovations that are taking place in Medicaid health care today. Today is February 28th, 2012. I'm Richard Yadon, President of Managed Medicaid Services, and your host for the next hour here on the only live talk show about the business of Medicaid health care. And isn't there a lot to talk about today in Medicaid? A lot is happening, and this, of course, is where you come to get in-depth information about it all. It comes to you from industry's thought leaders, corporate and government leaders, and from you, our listeners and our viewers of the Medicaid Matters talk show. So how exactly does it come to you? Well, there are several ways you can be interactive with our show. One is you can just watch or listen to Medicaid Matters. You can do it all right there at MedicaidTalk.com. You can get all the great content that we're going to share that way. No problem with that. But if you really, really want to dig deep, if you want to share a comment or a question, hey, guess what? You can do that right here on the air with us. And the easiest way to do it is to just give us a call. The number is 626-657-2125. That's 626-657-2125. If you're watching us on Ustream, you'll see that it's scrolling across the top of the screen, so you can call us at any time during the show. That's where you want to call and ask a question of our guest today or leave a comment. You can also tweet us your questions. You can send them to @MedicaidTalk, and we want to hear from you. We want to hear from you while we're live here on the broadcast with your questions, comments. Share your experiences as well. Well, a few weeks ago, we had a great time in Orlando. We were at the Medicaid Innovations Forum. It was a real treat for me and our team to get to meet some of our listeners and some of our viewers there personally. I very, very much appreciate the feedback. We don't have to meet in person to give feedback. If you ever want to, we certainly welcome it. But you'll have another chance next month. It'll be at the end of April to meet with us personally. We're going to be at the Medicaid Health Plans of America annual awards presentation on April 30th. The Medicaid Matters show will be broadcasting live from the U.S. Chamber of Commerce, and you can certainly see more details about this at MedicaidTalk.com in the next coming weeks as we have more information on our site. Well, today's show is about interventions that work, the changing face of Medicaid. If you were at the Medicaid Innovations Forum, you got to hear something about this from today's guest, Linda Hamacher. It was so interesting that I knew I had to share it with our larger Medicaid Matters audience. Now, Linda's going to be here with us in just a few minutes, but first thing I want to let you know about is a new series of highly informative webinars that's going to be presented by the Medicaid Health Plans of America. And on the phone with me right now is Michelle Martin. Michelle is MHPA's director for the director of the Center for Best Practices. So, Michelle, thank you for stopping by and spending a few minutes with us.
Hi, Richard. Thanks so much for having me.
Well, why don't you give us a high-level overview of this new series, maybe a few of the upcoming topics, and tell us a little bit about how people can get involved with this.
Sure. So the Insights webinar series is a subscription-based package that we put together. It will be 20 webinars starting on March 12th, taking place over the course of the entire year. Different topics. Like I said, there are 20 different webinars in different topic areas, like hot trends and topics, improving your operations, risk adjustment, compliance issues, dual eligibles. So lots of information is going to get covered. As the year goes on, we may be able to add a couple more webinars to our list, so that is very exciting. It is a subscription-based series, but you can get more information for it on our website at mhpa.org.
Mm-hmm. And you said the first one is on March 12th. Is that correct?
Yes, March 12th.
And
that is that will be on dual eligibles. I'm sorry, it's not. It's on fraud, waste, and abuse for the first one.
Well, both of those are hot topics in Medicaid right now, so I'm sure our listeners will want to know about them. So they can get all the information about how to register, dates, times, and things like that at mhpa.org. Is that correct?
That is correct.
Okay. Well, great. It sounds really exciting. I hope that our listeners and our viewers can take advantage of this resource. And Michelle, if you keep us updated on how this is proceeding. I know that we've done a lot of things with Medicaid Health Plans of America. Everything that comes from them is first class, so I'm sure this will be just the same.
Thank you so much. We look forward to having your listeners join us for our webinar series.
Well, great. And thanks for joining us for just a few minutes this afternoon, and we hope to have you back again soon.
Thank you so much.
All right. Well, I know all of you are wishing that you can be a part of this series, and we want to help you do that. Medicaid Talk, or Medicaid Matters, we're going to be able to give away access to one webinar of your choice to one of our listeners. So just go and register for our blog at medicaidtalk.com, and we'll select someone before that very first webinar on March 12th. Why don't you go ahead and register now? And that's what we do on Medicaid Talk. We connect you to resources, the people, we connect you to the information you need to be successful in today's Medicaid business environment. And that's also why we have Linda Hamacher as our guest on today's show. Let me tell you a little bit something about Linda and why you're going to want to listen to what she has to say. Linda currently works both as a senior consultant with Health Management Associates and as the CEO of the Genesee Health Plan. Linda is a recognized authority in the areas of health benefit delivery and managed care with broad management and consulting experience for both private and public sector plans. Her background includes managed care development, including Medicaid, managed care programs, compliance, plan design, risk assessment, evaluation and provider contracting, sales and marketing, and utilization management. Most recently, Linda has been working with local communities in the planning and design of community-based options for the uninsured, the underinsured, including subsidized employer options. She has designed and helped community-based programs develop sustainable funding, disease and care management programs, and recently assisted a local community in a successful initiative to fund coverage for the uninsured through local property taxes. She assists health plans with the operations, administration, and sales and marketing, as well as development of special care programs for lowering health care costs. She also performs feasibility studies, risk assessment, and financial pro forma for plans. So, Linda, I want to thank you for being here and welcome today to Medicaid Matters.
Well, thank you, Richard. I really appreciate you having me on.
I know you wear two hats, one as a CEO and one as a senior consultant. So why don't you tell us a little bit about how you came to be working in these two roles?
Well, I think it's kind of an interesting story, actually. I joined Health Management Associates 15 years ago after, my background is in managed care and Medicare and Medicaid. And 15 years ago when I joined HMA, I worked on several projects during a time when HMA was helping to establish several county health plans. There are right now 27 county health plans in Michigan, and HMA was helping communities do this. And I really was so pleased to be able to work on Genesee County especially, because that's where I live. I grew up there. Flint, Michigan is the city that everyone is familiar with in Genesee County, because it's rather notorious for being a very depressed community, and a community that has had a history of really being going from boom to bust, if you will. So I was able to start to set the health plan up as interim director, and I began actually building a patient-centered medical home for the uninsured from the bottom up. So it was a very exciting project, and during this time, the health plan's board recognized that there was really a value of having a real depth of expertise that my background brought, and the expertise that Health Management Associates offered, and the arrangement allowed me to do the work that I loved, and I think the success of the program is really speaks for itself. Mm-hmm. Of course, the best part is that I also get to work with other plans in Michigan and other states, other communities, to help them help the uninsured and to prepare for the Medicaid expansion in 2014.
Mm-hmm. And you were able to share some very interesting demographic statistics at the Medicaid Innovations Forum when I first talked to you about this. Some of the things that you talked about were, I was very surprised to learn about. I mean, certainly, I think everyone understands, the impact that the recession has had on the state of Michigan, but it seemed to be very focused in many ways in your community. And you talked about the so-called new poor. Why don't you tell us a little bit about the impact the recession had on your community and how that has changed the Medicaid population that you're working with now?
Well, certainly, historically, the Medicaid population has been mostly, moms and kids and the disabled. And what we have found in our community is that because of the actual collapse of the manufacturing in our community, we went from 80,000 General Motors jobs to 8,500 General Motors jobs. So the unemployment rate was very high. A lot of people who have been historically worked hard, have been middle class their whole lives, have suddenly found themselves not only without a job, of course, but without health care coverage. The Genesee County community really felt that the scope of what was going on was so deep that they really needed to come together to figure out a way to address this problem. Mm-hmm. So lots of these folks went from, $100,000 a year middle class homes to both, if you will, calling Marvin. And in the state of Michigan, the unemployment claims are done over the phone, and I've heard more people say, well, now we're both calling Marvin, and meaning that, both breadwinners in the family are now unemployed, and of course, eventually those services run out, and they find themselves in a situation of having to ask for help the first time in their lives.
Mm-hmm. So you went from 80,000 manufacturing jobs to 8,500, so almost a 90% decrease. How did that change the enrollment in Genesee Health Plan? What was the increase in enrollment at that time?
Well, we started out 10 years ago at about 2,500 people. We started out with enough funding to think of that we could cover a few thousand people, but today the enrollment is right around 25,000. So, and if we had the capacity, unfortunately, we could also continue to expand the enrollment, because we're continuing to see 700 to 800 newly uninsured people a month. And these are people who have not been enrolled in the health plan before. Mm-hmm. So they come to us for help, and the health plan is set up as a Medicaid waiver program that funds a portion of our coverage. The Medicaid waiver portion covers people up to 35% of the federal poverty level, which is not very much. It's less than $500 a month for two people. So it's these are people who are very poor, and many of them quite sick. And then we also cover, if you will, the working uninsured up to 175% of poverty, which is just under $19,000 a year for an individual.
Okay. Well, we're going to take a short break for 2 minutes. We've got some questions already coming in for you, Linda, so we're going to get to those as well. So we're going to take just a short break here, and then we're going to hear more from our guest, Linda Hamacher. So stay with us.
Elevating the quality of care with less cost. Today, that's the job of every Medicaid managed care company, but it can't be business as usual. Companies have to coordinate care a different way. The solution is managed Medicaid services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new Advanced Care Transitions program, companies can dramatically raise the quality of care without increasing their costs. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
The Medicaid landscape is changing fast, and that means challenges. But it also means opportunity. Opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net is the place to showcase your talent to Medicaid companies, search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
Well, welcome back to Medicaid Matters, the only live talk show on the business of Medicaid health care. I think it's safe to say we are all experiencing the rapid changes, new technology, regulations. It seems like you name it, it's going on in Medicaid right now. And it's also creating some wonderful opportunities for Medicaid professionals in almost all areas of the industry. For instance, in the public sector, there's a need for a Medicaid health system specialist in Ohio. And as you know, there's a lot of activity going on in Ohio right now and in the coming months. On the private side of Medicaid, health plans are searching for medical directors in Louisiana, in Iowa, directors of compliance and regulatory affairs in Missouri, network development managers in Kentucky, just to name a few. And for experienced Medicaid clinical and business professionals, this is a great time to explore your career options. You can find all of these jobs and many others that are listed at MedicaidJobs.net, so go there today and see what you might be missing. We're talking with Linda Hamacher, CEO of Genesee Health Plan, about interventions that work and the things her company is doing. Linda also gave a presentation at the Medicaid Innovations Forum on this topic. If any of our listeners or our viewers would like a copy of that presentation, she has graciously made that available. Just go to MedicaidTalk.com, sign up for our blog, and you'll be sure to get a copy of that. Linda, we were talking right before the break about the model, business model that and health plan model that Genesee Health Plan has undertaken. It's a little bit different than what we typically hear about on our show. Why don't you take a few minutes and kind of give us an overview of the Genesee Health Plan model?
Well, as I stated just before the break, we actually have two different segments of population that we're covering. Those who are earning up to 35% of the federal poverty level, and then those earning up to 175%. So it's quite a mix of people who have been recently unemployed or lost benefits, and those who have been sick or sort of on the finding themselves in an unfortunate situation for some period of time, and they really do present with different needs. But the thing that really makes our program different, I think, is that we focus on self-management support of our members, recognizing up front that our patients really do face multiple daily challenges. I mean, we all can appreciate, when you go with your basic needs being unmet, that there are going to be barriers to getting health care. You're not even thinking about being healthy. You're thinking about how are you going to feed your family and how are you going to buy gas and those kinds of things. But in addition to that, there are things like, of course, class and racial discrimination, mental illness, homelessness, language barriers, and other kinds of cultural barriers that can prevent people from from actually accessing health care, even if they have the benefit. And so our goal is to really improve patient outcomes by improving the patient's self-management of their disease and getting the patient to focus on healthy behaviors in their life.
Well, great, and it's a great segue into my next question, because at your presentation at the Medicaid Innovations Forum, you highlighted 3 interventions that seem to be getting a lot of positive results in your community. So let's talk about the first one that you presented and the one you just mentioned, which is self-management support. What is the overall goal of this particular type of intervention that you've established?
Well, the overall goal, of course, is to reinforce healthy behaviors and improve self-management of disease so that people who have, for example, a typical example would be someone with diabetes. It's not only helping them to test for test glucose levels and get their feet checked and all of those kinds of things that we encourage people with diabetes to do, but it also focuses on changing their life in a way that increases healthy behaviors and focuses on health in their life. And this is something that we have found that the members really do respond to this, because it shows that they love to know that someone cares, that someone is there to help them, and that as our health navigators work with them, they really do learn how to motivate these members to be healthier in their lives and to focus on things like exercise and nutrition and all those things that we know can improve health in your life.
Mm-hmm. It's as most of our listeners and our viewers know, I really have spent a lot of time on a show talking about the need to have more individual involvement in care and people having an opportunity to take more responsibility for their own care as a means to control cost, as a means of really how we're going to get to being a healthier country overall, not just necessarily in Medicaid. So tell us a little, because I want to dig into this just a little bit more, because I really am intrigued with how you have set this whole self-management support intervention up and how people get involved with it. Maybe you could just talk a little bit more about, how does the whole process work in your organization?
Well, patients are first identified with an enrollment survey up front that asks them questions concerning prevention, chronic disease. We want to know if they have diabetes, do they smoke, what is their perceived health, do they have asthma, chronic pain, depression. Those types of questions are asked up front. Additionally, people are referred into the self-management program by their provider, by their primary care physician or a specialist sometimes, or by another community agency that has come upon someone who really needs this type of help. We also find people, when we do follow-up from post-emergency room and hospitalization visits. So they're identified to us the day after they've been in the hospital so that we can contact them. And so people find their way into the program that way. And also we identify people after enrollment through chronic disease diagnostic reports, so that if someone, because many times when patients have been uninsured for some time, they haven't been diagnosed yet, so they may not know they're diabetic when they enroll. So once someone has been diagnosed with a chronic disease, then we also include those folks into the program and start contacting them and start beginning to work with them.
Mm-hmm. You mentioned a moment ago a term that some of our listeners may not be completely familiar with. That was the term health navigator, which I know has been around for a while, but it seems to be becoming more prominent in different health plans. Tell us a little bit about that person in your organization, who they are, what they do, and how they work.
Well, sure. Our health navigators are folks who are generally work in a team setting. We have some RNs. We have some who are social workers, and we have some who are simply very sensitive, open people that people really do respond to. So there's not a set type of person. It just needs to be someone who is very sensitive and who is willing to be trained in motivational interviewing, so that we can develop a collaborative, person-centered form of guiding them, guiding the patients to be self-motivated. And so the health navigators really focus on, I would say, 3 basic areas, and that is supporting the practice, supporting the patient, and linking that patient to other community support services that they might need.
And I would imagine, and if I remember correctly, when we talked about this a few weeks ago, you've seen quite a change in the level of engagement from members as a result of this. Is that correct?
Oh, absolutely. The outcomes from this type of intervention has really been amazing. We have seen a 50% initial decline in emergency room utilization, and this continues to be a downward trend for this population. We also saw 15 fewer inpatient hospital stays, and I think that this speaks well to having primary care certainly in place and a prescription drug benefit in place so that people can get the medications they need. A lot of this has to do with having covered services, but we know that following up after an inpatient stay and following up after an emergency room event really does make a difference, and it gives us the information we need to better educate the providers, because many times we'll find out that the provider's staff at maybe a certain physician's office was just referring everybody to the ER, or that we'll find out that the patient called the physician, couldn't get in to see the physician soon enough, and so just went in on their own to the emergency room. So it helps to educate us and the provider as well about what is really going on at the ground level. And And then also concerning healthy behaviors, we have seen a 78% improvement in physical activity, 53% improvement in eating habits, which is hard for anyone to do.
Yes.
17% reduction, yes, all of us. 17% reduction in smoking and 82% improvement in self-management of self-monitoring of diabetes. So we're really pleased with those outcomes. And I would also mention that that people enrolled in the health plan have the same number of wellness visits per member per year as a commercial HMO population in our area. We did do a study to compare those, and it was pretty astounding, and we were very proud that our uninsured population was getting just as many wellness visits as people with, full coverage plans. And that probably explains why mammograms have quadrupled in our community for women.
Wow. Well, those are certainly impressive results. There's no question about it. I know many plans would like to see those types of results in their population. We're going to pause here before we start the second half of our show. If you haven't been there yet, take a minute and visit our page on Facebook. Medicaid Talk allows you to connect there with other Medicaid professionals and others that are involved in the industry. You get timely updates and articles about important Medicaid topics. So stay with us. Lots more to come.
You're listening to Medicaid Matters on the blogtalkradio.com network. Are you a Medicaid industry expert, state executive, or thought leader? Can you share a perspective about the business of Medicaid that's unique, innovative, or even controversial? If so, you could be a future guest on Medicaid Matters. We are currently scheduling guests, and it's time to share your big idea about Medicaid. Go to our website and send us a message. Tell us what you want to talk about and how we can contact you. Make your voice heard. Make Medicaid better.
Well, if you or your company are trying to get a message out to the Medicaid business community, this is the place to do it. You can become a sponsor of Medicaid Matters and reach more of the targeted Medicaid community. If you'd like to learn more about being a sponsor, you can email us at info@medicaidservices.net or just call us at 615-257-1627. Let's get back to Linda Hamacher, CEO of Genesee Health Plan. And again, if you'd like a copy of her presentation on this subject, you can get it by signing into our blog right there at MedicaidTalk.com. Linda, I remember when we were talking a few weeks ago, you quoted one of your members as saying, "For me to pay attention, tell me, hand it to me in person, then call me, mail it to me, email it to me, and put it on the internet." That might be a way to catch my attention too. But has this been something that Genesee Health Plan has actually been able to operationalize in their communications?
Well, it's quite a challenge. I think that staying in touch with folks and doing the follow-up work is probably one of our greatest challenges. I will say that we are doing much better at this. At first, we were kind of like everyone else in thinking that, low-income people are not going to have access to computers. They're not going to have, they're not going to be tech savvy, and we don't need to worry about using social media to reach them. And we were wrong, because we really did see all of a sudden that we had been sort of neglectful of building our social media and coming up with ways to use new technology to reach our members. So we are getting much better at that. We certainly do tell it to them and hand it to them and send it to them. But we continue to improve the social media piece of this. But honestly, it does continue to be a challenge. You know, someone can be in the office in crisis, absolutely in need of urgent health care, and the number that we have for them, 20 minutes after they leave the office, their cell phone's dead or it's been turned off, and then it's our challenge in how to reach them and stay current. We get our physicians to work with us on this. They certainly notify us of changes and phone numbers and addresses that we don't always get. And also our pharmacies have been very good about informing us of changes. So we, along with everybody else, are continue to try to figure out how we're going to make the best of communicating with our members electronically.
In the area of social media, which seems to be for many of health plans, I know for some of our clients, has been a bit of a mystery about how do we really engage our membership in social media. Just real quickly, how do you go about doing that at Genesee Health Plan? How do you use social media?
Well, we of course have a Facebook page, and we have a tweet account, and we have a website, and we also try to get. We collect email information and email addresses with everyone, and we're getting better and better about keeping up that electronic communication with our members. And we're also learning that we're using these sites for members to communicate with us as well. I just did a series of focus groups, and this was of the uninsured and Medicaid members in our community. And this was one of the areas that I was really most interested in, because this population is so mobile. I mean, it's very difficult to stay in touch and to do the follow-up work with them sometimes that we really need to do. And I was very impressed, really, with how tech-savvy the population really is, and how they really are open to that type of communication and really do want that type of communication. But the number one thing that they said was a good old U.S. mail. If it says on the good old U.S. mail that it's from their health plan, they're going to open it. Now, this was from a small group of people. This was from some focus groups, but it was very, it was definitely everyone in the room saying the mail is the very best thing. If all else fails, but again, going back to that comment, they need to get information from every single direction, and it needs to be consistent and over a long term, because they're dealing with a lot of stuff just like we all are, and healthcare is not the thing that they're thinking about when they get up in the morning. So, it's up to us to make the communication concise, consistent, over long term, and from a lot of different directions.
I can certainly attest of the difficulty of contacting members, and in the work that we do for our clients in just completing home-based assessments. As much as 40% of the information we receive could be incorrect. So we've had to find people through neighbors, through home health agencies. We've found them under highway bridges, and our assessors have done assessments there before. So it's a very mobile population, absolutely correct, and you have to be very innovative in trying to connect with everybody, no question about it.
Yeah, and I can't say enough for having a really strong organization of safety net of the safety net in your community, because if all of the safety net organizations, the healthcare, the food, housing, if everybody can really work together and stay in contact, you can. It makes it much easier, because if someone drops out of sight somewhere, chances are they're going to surface somewhere else, and we'll be able to make contact with them again. And I can't say enough about the safety net community in Genesee County of being, willing to work together. The other thing that we did is develop what we call our data web system that we use to track all interactions with our members, and it also interfaces with our claim system. So we're really able to tell if people have, for example, gotten their A1C test, or if they have had some critical prescriptions filled. We're able to see that, and we're also able to, as part of the system, it actually has a crawl going across the top that will give us very important information about this person, so that we don't have to go through all of their history in order to know if they have some type of medical or mental health crisis going on. And this system is also our mental health providers and our medical providers also have access to this information. So,
wow, very comprehensive.
Yes, it is very comprehensive, and people are very surprised sometimes when they'll say, "Well, I went for that test," and we say, "Well, no, you didn't, because it hasn't shown up, and you didn't go for your follow-up visit." Many times after, one of the questions we ask after the emergency room visit is, "Do you have a follow-up appointment with your primary care physician?" "Oh, yes, and then the next time we'll call them, "Did you go to your appointment?" "Oh, yeah, I went." I went, and then we say, "Well, no, you didn't go," and it's very critical. So it's those types of things that really do change outcomes.
I think the trend towards putting more community-based assets into the care plan, into the mix of providing care, is a trend that I know in our business we're seeing happen more and more across the country. I'm wondering if in your consulting hat that you wear, if you're also seeing this as well.
Are you talking about the integration of community resources into healthcare treatment?
Yes.
Plans? Yes. Oh, definitely. I think that people are finally getting the message that it doesn't take a lot to just contact someone and maybe make a few phone calls on their behalf or get the information to them, and I think and to their primary care provider. The providers are happier, the members are happier and healthier, and we get to feel really good that we've helped someone.
Mm-hmm. Yeah, no question. Well, we're going to take our last break here, and then we're going to get back with Linda. So stay tuned for more. We've got some questions from our listeners and our viewers to go through as well, and we'll be back in just a few minutes.
I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
By providing access to the care they need and the quality they deserve, Medicaid health plans enhance health outcomes of our nation's underserved. Just listen to how a Medicaid health plan made a difference to Miriam.
I was 10 years overdue for my annual mammogram when my Medicaid plan case manager called and convinced me to just do it. The mobile mammography van my plan provided made it simple. Breast cancer runs in my family. That phone call may have saved my life.
Medicaid Health Plans of America, ensuring access to better health care.
And this is the Medicaid Matters, the only live talk show about the business of Medicaid. We're here every other Tuesday at 1 p.m. Eastern Time. If you've got a question or a comment about our topic, now would be the time to ask. We're here on the last segment of our show. We've been talking with Linda Hamacher, CEO of Genesee Health Plan. And Linda, we've had some questions come in from some of our listeners. Let me pull that up on my screen here. And I thought you might want to take a crack at these because I think they're very interested in what you've been talking about. The first question is from Russell in Indiana, and Russell asks, what is the greatest risk to your plan in 2012?
Oh, excuse me. The greatest risk to our plan in 2012. That's an interesting question. You know, we are... the challenges that we have are the challenges that we are funded by a property tax millage for our Plan B members. That's the folks who are up to 175% of the poverty level, and so that funding comes from local property taxes, and certainly that revenue has decreased dramatically. And you know, with the fall of property values. And I think that part of it has hurt not only Genesee Health Plan, but things like transportation and funding for public health services. And all of those things that taxes pay for in a community are underfunded because of the crash in property values. And I think that is a very direct threat. We're all doing more for less, but it also means that some of the things that we really depend on, it's not only us that is getting less funding, it is, you know, the rest of the safety net too. So it's been a very tough time, and I would say that's probably one of our top challenges.
I could imagine. Certainly, finance is a challenge for almost every Medicaid health plan right now. Now, just want to make sure I clarify: does all of your funding come from the property tax?
Well, a portion of it comes from the state of Michigan for the Medicaid waiver population, and then a good portion of it comes from the property tax payments, and then the rest comes from grants.
And if I remember you telling me correctly, didn't you recently have a vote where the members of your community, the residents of Genesee County, voted to increase that so they could fund this more?
Yes, and that was actually passed in 2006.
Okay.
And it's really a pretty amazing story that a community like Genesee County can really take on healthcare and can really make a difference in the lives of people in the community. They just said, you know, we're going to do this. And 85,000 people voted to increase their property taxes in order to fund the health plan. And it was just an amazing groundswell of support and a very much a grassroots effort to help the uninsured in our community. So I just can't say enough about the community, about the board of directors, the 3 hospital systems. It's been one of those those cases where everyone came together to tackle an issue, and they did a pretty good job of it.
Well, you don't normally hear a story like that, especially in today's political climate with all the talk about taxes from one thing or another. So it is a pretty remarkable story, and I think it, obviously the members of the community saw that there was results coming from the health plan, and I think it's a testament to the leadership there to get something like that done. Cheryl in New Jersey asks this question: are there any programs that you have wanted to implement that you have not had the resources to make happen?
Oh, that is a great question. I would love to be able to implement a full-blown dental program. We're finding that dental is the third highest emergency room issue, and in our community, it is absolutely a travesty that adult people in our community do not have access to preventive care for dental, and they end up with horrible dental issues, infections. Many of the people that are referred to us for dental issues come from the emergency rooms where they've gone for palliative care and for antibiotics for infection. And so we have, out of necessity, have taken on the worst of those cases. But we just don't have the money to expand that program and to really do preventive care and really help everyone, that needs help. So that would be my number one vote at this point.
Have you integrated anything in your communications program about better dental hygiene, better dental care to your members?
Well,
even if you can't, even if you can't offer it as a benefit.
Yes, we do have a dental hygiene school as part of Mott Community College in Flint. So we try to utilize the school as much as we can for those cases, and we try to communicate certainly about the importance of good dental hygiene and all of that. But quite frankly, there are so many cases that are so bad that our focus has just been at this point trying to help those that need help the most, while trying to communicate the importance of dental hygiene. It's the old, how can you focus on prevention when you've got all this horrible stuff going on? But with dental, that really has been the case.
We did a show, I think it was this past fall, with some representatives from Liberty Dental, and talked about the impact that dental health has on the overall health, and the way they were working with Medicaid plans and in crafting kind of customized dental programs for different populations. Might be something, if our listeners have an interest in that, in checking that out. But I was really surprised to learn the impact that good dental health can have just on the overall health of the member.
Oh yeah, and it's not only health; it's self-esteem. It's being able to go out and get a job and be productive. It impacts your entire life when you don't want to smile and you're in horrible pain. It's just it impacts the entire person. And we have certainly learned that it's very difficult, though, in our community anyway, to get dentists to do dental work at Medicaid rates. They're so low, and it's it's just very, very difficult, even when it is a covered service, to get a good, robust delivery system, because they just can't do it for those rates. So it's a huge problem, and that I would love to tackle that.
Well, we've got about 4 minutes or so here left, and I wanted you to talk a little bit about the post-hospitalization and ER support that you have established in Genesee Health Plan. What are you doing in this area?
Well, it's this has been a project that we're working on with one of our hospital partners, this Genesee Health System, and the goal of this project is to learn, why do people go to the emergency room, and how do we keep them out of the emergency room? Mm-hmm. So we have it set up so that they notify us the morning after. We get a list and the contact information of folks who have been in the day before or the night before. We contact those people and go through a questionnaire with them that asks some pretty basic stuff, but it has had a very big impact on the number of repeat emergency room visits. We ask, do you have a follow-up appointment with your physician? Do you have the prescriptions that you filled, that you were given in the hospital? And do you have food in your refrigerator? And those three things are huge, are very huge items that will have to do with keeping that person out of the ER. Mm-hmm. If they have, we help them. We try to help them get their prescription medications. If they don't have them, we'll schedule a follow-up meeting with the physician if we need to. And if it's someone who is in a situation where they don't have fresh food in their home, they don't have anything to eat, we try to make arrangements to get that handled as well through our other community organizations. So with this type of support system, it's very simple stuff, but it really does make a difference. The other things we ask them are, did you call your physician before you went? What did the physician say? When were you last in the ER? When were you last hospitalized? Just some basic issues, and of course, why were you there? And then that way we're able to begin working more closely with that patient to make sure that they are getting primary care and the type of basic health care they need that will keep them out of the emergency room.
Well, Linda, we're almost out of time here. It has been very interesting to learn about what you're doing up there in Michigan. I know there's a lot more going on than what we had a chance to touch on with here today. Maybe you could come back at a later date and update us on some of those things.
Oh, I would really enjoy that. I didn't really get a chance to talk about chronic pain and our chronic pain management programs that have really it's the one thing that most people that come into the plan have. So I would love to share that with you.
Well, great. We'd love to hear about it. Well, thank you again for being on today's show.
Thank you.
90 seconds.
If you have been to MedicaidTalk.com, you know that we have some other very interesting shows that are coming up. If you'd like a copy of Linda's presentation, you can get that by becoming a part of our blog audience, and you can do that right there at MedicaidTalk.com. Our next show is Tuesday, March 13th. We're going to be learning about some strategies to reduce hospital readmissions, a very hot topic in Medicaid today. Our guests will be 2 senior members of the Camden Group.
60 seconds.
And don't forget also, you can go to MedicaidTalk.com and register to receive a free Best Practices webinar from Medicaid Health Plans of America. That's a $150 value. Just sign up for our blog and you're in the drawing. We hope to see you at the Medicaid Health Plans of America Awards function on April 30th. Until then, this is your host, Richard Yadon. Today is Tuesday, February 28th, 2012, and you've been listening to Medicaid Matters, brought to you by Managed Medicaid Services. We'll be talking again in 2 weeks. Have a great time.